My name is Dr. Rona Iskander. I am a dentist, the CEO of Chelsea Dental Clinic, and a co-founder of Parlour Oral Care. Today I want to talk to you about Curodont, which has been a massive game changer in my practice. Curodont Repair is a non-invasive, biomimetic, regenerative solution for the repair of early enamel caries. It is based on the self-assembling peptide technology, which uses the patient's own ions from their saliva for in-depth regeneration of hydroxyapatite in early enamel lesions. Early stage enamel caries is documented in up to 80% of cases. What do dentists do? They watch and wait, or there's early intervention which damages natural healthy tooth structure. Come in Curodont Repair, which is tailored just for these cases, which repairs and arrests these early enamel lesions without needing to do drilling, and has up to 90% success rate. It helps preserve the integrity of the tooth without damaging the teeth. It's quick to use, it's pain-free, and it's an in-office treatment which my patients love. Both my dentist and hygienist have been using this and have told me that patients are absolutely sold on the idea of tooth preservation with minimal intervention. So how do you use Curodont Repair? Well, it's very fast and easy. The first part would be to clean the tooth thoroughly. Cleaning the treatment site involves removing the saliva pellicle. After rinsing and drying, the site is etched with 35 to 37% phosphoric acid. This is to remove any inorganic particles that might be blocking the pores of the surface layer of the lesion. After rinsing and drying again, you use cotton wool to isolate the area where the cheek, tongue, etc. is. The Curodont Repair applicator is then activated, and the saturated sponge is squeezed onto or near the lesion area. Once the liquid is deposited, it is allowed to diffuse for about 5 minutes. During this time, the patient is counselled an oral hygiene advice and brushing technique, and then after this, you can discharge the patient with the instructions and not eating or drinking anything for up to 30 minutes. There are many benefits to Curodont Repair. Obviously, the early intervention of early stage caries means that we don't just watch and wait for things to get worse. We also aren't creating too much damage to the natural, beautiful tooth structure, and we are not being invasive, which is the philosophy that we should all be practicing in our dental practices. It's tasteless, it's non-invasive, and it's also non-staining, which is a bonus for the patient. It can be easily integrated into the existing workflows, and it's easily managed by your hygienist and the whole team. This is something that can be brought into treatment processes which already exist. It can be used on all teeth, all surfaces, and in any age of any patient. So you may ask, how do I talk to my patients about Curodont Repair? Well, this conversation is much easier than you would think. I begin by explaining to them they have an early enamel lesion, and I tell them that although it is not painful, you do not want to wait for pain. I liken it to other diseases of the body and say, would you want to wait for something more sinister to happen before you started finding pain? No, you want early intervention. I use leaflets and booklets to explain that disease progression can happen slowly, and once it reaches the nerve, it can become very painful. I then tell them about Curodont Repair, and I explain that this is a non-invasive and easy way to prevent the cavity from forming further, that it's painless, that no anaesthetic is needed, and it's non-invasive. And usually my patients think, well, this is a no-brainer. I also explain to my patients that anaesthesia is needed, which they often associate with going to the dentist. Moreover, I coach them that with this treatment, in conjunction with good oral hygiene, that we can stop the lesion in its tracks from progressing and prevent the filling further. Curodont Repair is pivotal to dentistry as a whole. It is that push for intervention that doesn't actually require us being invasive or compromising the teeth in any way. It is the push that we need. It is what patients are desperately looking for within the dental industry, and options that don't require drilling of the teeth. This is something very empowering to the patient. Like in medicine, it addresses the subclinical stages of caries disease, which is the most prevalent non-communicable disease worldwide. Curodont Repair can have a tremendous impact on dentistry as a whole, moving us towards a more conservative and preventative approach. Curodont Repair is a more conscious approach to caries management. It is an intervention that doesn't just require us hoping and waiting for the best, nor does it require us to do something that's hugely invasive. It really is something that dentistry has been waiting for a long time. Curodont Repair represents a medical approach to caries management, and it's a step towards a more conscious approach to caries management. It enhances patient care and is a step towards improving the oral and overall health of the population. I just wanted to show you how easy it is to use. So this is the application, vVARDIS Professional Curodont Repair. You can see that this is it. And the sponge is inside. You push it in. Let the liquid all soak up into the sponge. Here is the sponge to place it on the surface of the tooth or the area of concern.